Hello, my name is Dr. Hannah Bahlhorn at Ivory Point Dentistry, and today we're going to talk about Invisalign. This is one of my favorite subjects, Invisalign, straightening your teeth. Now I'll have to say the reason why it's one of my favorite subjects is because when I was 15 years old, I started my career as a clinical orthodontic assistant. So my first door into dentistry was watching people's smiles be transformed from crooked to straight, giving them confidence and allowing them to function and chew with confidence. Invisalign is important because it's a tool that we use to help align and bring our teeth into a more harmonious state. When we have straighter teeth, we have healthier teeth. A lot of people will come in and they'll say, "Doctor, I don't care about the cosmetics, but I do want to keep my teeth for as long as I can. I don't want to have a denture. I don't want to have teeth that are missing or loose or that are painful." And my answer to that is sometimes let's talk about how your teeth are set inside of your mouth. The way that our teeth are positioned in our mouth does matter. It also plays into the longevity of your smile and the health of the gums and the bone. When our teeth are straight and then when we are chewing properly and the forces are divided evenly, then those teeth can last you a lifetime. When the teeth are crowded or they're shifted or they're chipping, bone is often lost in the front segment of our teeth. As the teeth shift, you'll notice that they're wearing unevenly. You're noticing that more fracture lines occur and they become more painful. Sometimes the bite is actually a huge part of why people have temporomandibular joint disorder. People will come in and they never would consider that all of that crowding actually plays in to why they're having headaches. And that's why I love Invisalign. It's a tool that we use to align the teeth into a proper form and function. It's also very convenient and easy to wear. It's never been more invisible, more convenient to align your teeth into a proper position. I've had so many patients complete their treatment and say, "You know what, with my bite better, I noticed that the pain on that tooth is gone. I notice I'm getting less headaches." My hygienists love it for their patients too, because the cleanings are easier, the teeth are less crowded, and plaque control and oral hygiene are better. I always say that straighter teeth are typically healthier teeth, and that plays into the longevity of your teeth. I often get asked this question, should I consider traditional orthodontics that comes with bands and brackets and wires, or should I consider Invisalign? Am I a good candidate? And those are great questions. The technology has come such a long way in the last 10 to 15 years. Things that we weren't able to do before with clear aligners and Invisalign, we can now do. There's so many auxiliary treatments and adjuncts to our therapies that allow us to treat a wide variety of malocclusions, tipping, and chipping. I find my patients like it more conveniently because it's not noticeable. My patients will ask me when they come in, how long will my treatment typically take? And it just depends. It depends on what our goals are and what we're trying to accomplish. If we're trying to unravel crowding, whether we're trying to get set up for a perfect bite to then reinforce it with veneers, there's all different segments of treatment. Typically, orthodontics is around 9 to 12 months. Some cases that we want to do extra care with or need a little bit more, they can go up to 15 months of treatment. But a typical Invisalign case is approximately about a year. One thing I love about Invisalign is you can still enjoy all of your favorite foods, drinks, and beverages. The only thing is you just have to remove your aligner, enjoy your snack, clean your teeth, and then resume your treatment just as you would have before. Invisalign is designed to put a force on your tooth to move your tooth into an ideal position that helps with the longevity and the health of your tooth. How long do you have to wear each aligner? Most aligners are worn for about 10 to 14 days each, and you're switching the aligners out every 2 weeks. Thank you so much for watching this video on Invisalign. If you want to know if you're a candidate or if you have any questions regarding Invisalign product, please give us a phone call at Ivory Point Dentistry.